Good morning, everyone. This is Sarah Willey from Miller Johnson. You're here this morning for the webinar regarding how to prepare your workplaces for employees to come back to work as our stay-at-home order begins to get lifted. Before I get started, I want to go through our news of the day, talk a little bit about what happened this weekend. Starting with the statistics of the virus worldwide, we now have almost 3 million confirmed cases, which is just astounding. And we have just under 200,000 deaths, 206,544 deaths worldwide. In the U.S., we have 965,783 confirmed cases, so just under 1 million in this country, and we are at 54,614 deaths, unfortunately. And here in Michigan, we are at 39,778 confirmed cases and 3,315 confirmed deaths. On the bright side, yesterday was the lowest number of new cases that Michigan has seen in a month. We had 575 new cases, and that's the lowest we've seen in quite some time. Hopefully that pattern will continue. Over the weekend, we saw 3 new executive orders issued by Governor Whitmer. Those actually don't include the one that was issued on Friday that we're going to talk about, the extended stay-at-home order. But we saw executive orders 60, 61, and 62 issued. So we're at 62 executive orders here in Michigan. There's one of particular importance for all of you. That's executive order 60, or at least some of you, I should say, that's 60, and we'll be talking about that one as well. The CDC has added 6 new possible symptoms of COVID-19. Those new symptoms are chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste/smell. Those symptoms have sort of been floating around other parts of the CDC website as well as other state executive orders. But they are now officially on the CDC's list of possible symptoms of COVID-19. The UK Prime Minister, Boris Johnson, is returning to work today, so that's a positive development because he recovered from COVID-19. He'll be getting back to work. And then finally, there was an article published that Stockholm, Sweden's capital, is expected to reach herd immunity in May. Sweden has taken a different approach in their response to COVID-19. They have not shut down schools, restaurants, etc. They have practiced social distancing, and so it'll be interesting to watch what happens in that country as they reach immunity. Okay, well, with that, let's dive into our presentation today. We're going to be focusing on all the things that employers need to be thinking about as they bring employees back to work, or even if they have had some employees at work as they ramp up their operations. So where are we now? Let's start there. Well, of course, we're still in the midst of this global pandemic. And unfortunately, we've come to understand that it's unlikely that COVID-19 is going to go away for quite some time. When this all started, I think that there was a misperception that we were all going to go inside for several weeks or a month or so, and that was going to make COVID-19 disappear, and we were all going to go out and carry on with our lives. Unfortunately, we've come to understand that that's not going to be the case at all, that we've stayed at home to flatten the COVID-19 curve, but COVID-19 is going to be here until at least we get a vaccine. And that appears to be quite some time off, 18 months or more. Where else are we? Well, also, unfortunately, the unemployment rate in Michigan is skyrocketing, and it's even exceeded what the Detroit Regional Chamber thought might be the bleakest expectations. So the discussion has now turned to when and how we reopen our communities and our businesses and our workplaces with COVID-19 still present. Okay. As part of this discussion, we need to understand what the likely requirements are going to be for workplaces in order to have employees come back to work. And we have not gotten a tremendous amount of clarity on either the state or federal level in that regard, unfortunately. So we have to do a bit of guessing as to what the landscape is going to be. We do have some resources that inform that guessing. So it's guessing with intelligence, right? It's making informed guesses. And here are some examples, and it's interesting to read these, and I encourage you after the webinar to take a look at them. But the White House has published a guidance that it's calling Opening Up America Again. It proposes a 3-phase approach. We have two guidances from the Republican legislators here in Michigan. The Senate version is called Opening Michigan Safely. The House version, they're calling it a roadmap. Those are also proposed phase-ins. One is a 3-phase, one is a 5-phase. On the federal level, there's a group called the Bipartisan Problem Solvers Caucus, and that's interesting, right, because it's bipartisan. And they've published something called a Reopening and Recovery Back to Work Checklist. That includes benchmarks to mitigate the impact of returning and to prepare to handle new cases of COVID-19. What else do we know? Well, we know that here in Michigan, Governor Whitmer is almost certain to impose some requirements on businesses in order to have people back to work. And through her recent executive orders, we have a bit of a window into what those requirements will likely be. So let's talk about those. A few weeks ago, she issued Executive Order 36. That executive order told all individuals in the state of Michigan that it's public policy for them to self-quarantine for a number of reasons. They're listed on the slide here. But they are if you have COVID-19, if you have symptoms of COVID-19, or if you've been in close contact with anyone with either of those. Now, on the employment side, Executive Order 36 is important because it also tells employers they can't take any adverse action against someone if they're self-quarantining for those reasons, meaning that is job-protected time off work. Okay, so we know first off from Governor Whitmer that she is likely to require employers to forgive certain COVID-19 absences when we get back to work. What else do we know? Well, for businesses that have continued to operate, the obvious examples are hospitals, grocery stores, gas stations, etc. There are already requirements for any in-person operations. The executive order that was issued on Friday, that's Executive Order 59, that extends the stay-at-home order, had several requirements, okay? And they are also listed on this slide to give you an idea of what might be required when all businesses are open for in-person work or even during that phase-in. So the first requirement is they all have to have a COVID-19 preparedness and response plan. There has to be a requirement that only employees who have to be in the workplace are there. You got to promote telework. Employers have to follow social distancing practices. There has to be increased cleaning and disinfection, protocol for cleaning after a positive test. There has to be policies and practices in place to prevent employees with symptoms from working. There's got to be limited sharing of tools and equipment. And any employer with in-person operations has to make available non-medical grade face coverings, right? So we've become very familiar with those cloth homemade face masks or bandanas. We all know that if we want to go to the grocery store now, we are required to wear one. Employers with in-person operations now also have to make sure those cloth face masks or face coverings are available to their employees. And I emphasize the word available because the executive order does not yet require those employers to make their employees wear them, okay? They only have to make those face coverings available to them. Now, if individuals work in publicly accessible forums, grocery stores, and places like that, those individuals, those employees are also required under Executive 59 to wear those masks. Governor Whitmer is requiring those individuals to wear them because essentially anybody who is in a public space like that is supposed to be wearing a mask. I will also add that over the weekend, our Attorney General, Dana Nessel, published a statement that she understands that many employers with in-person operations have been unable to obtain those face coverings over the weekend. And she issued a statement asking law enforcement officers to be understanding for employers who are making a good faith effort to get their hands on masks so that they're available to employees, but have not yet been able to do so in time for the Monday morning shift. This is a pattern, I will say, quite unfortunately, with the way these executive orders have been issued. They tend to be last minute and they tend to be without notice. And they tend to be asking businesses to scramble to do things like that very quickly, which is why it's all the more important for us to be doing the planning and work that we can be doing now in order to prepare to open. Okay. Over the weekend, she issued Executive Order 60. That applies to food selling establishments and pharmacies. But again, it informs what is likely for Governor Whitmer or what Governor Whitmer might require of other workplaces as they open. So for food selling establishments and pharmacies, in addition to everything I just mentioned in 39, Executive Order 60 says they have to have hand washing facilities available and breaks for employees to wash their hands. They have to have access to hand sanitizer and disinfecting wipes. They not only have to have a policy saying that sick employees can't work, but they have to prohibit sick employees from working. They have to do a daily health screening. There are additional social distancing measures that have to be taken. They have to accommodate vulnerable employees with either a low exposure assignment or an unpaid leave of absence. That is a new requirement. And when she uses the term vulnerable employees, it's not defined in the order, but we assume she's referring to those populations of people who the CDC has said are at a higher risk when and if they would contract COVID-19. Those are individuals over 65 and individuals with certain health conditions. There's a list of those on the CDC's website. And then finally, there's an explicit requirement that employees and vendors have to be notified in writing within 12 hours in the event of any employee testing positive. So that's what we know on the front with what Governor Whitmer has done and would likely do. We also can get some hints from what our local county health authorities have done. There's been several counties in Michigan that have required health assessments and or temperature checks during or before any employee is able to enter the work facility each morning. And then if an employee answers yes to any of the categories, meaning they have any symptoms or they've been in close contact with somebody who has tested positive or they've traveled outside the state of Michigan, then there is a mandated quarantine requirement. And so those local county health orders remain in effect, right? So if your business is operating in a county with any of those orders, that would certainly be something that you would be looking to comply with as well. And then finally, we know the CDC and OSHA has issued written guidance on what level of planning and what measures should be taken for COVID-19 in the workplace. So based on all of that, what seems certain here in Michigan? Well, I think we can all count on the idea that certain sectors are going to be open before others. Governor Whitmer has said important factors for her to decide who opens when are whether they're indoor versus outdoor, whether they're public facing, and whether they're likely to share tools and machinery. We can certainly count on the idea that this is going to be a phased or gradual approach. The lowest risk groups are going to be open first, and all of it is going to be based and contingent upon testing being available, as well as something called contact tracing. Contact tracing refers to the ability to determine who had direct contact with any particular person who tests positive for COVID-19. So what level of ability do we have to narrow down that pool of people who have been in contact with somebody who's now positive so that we can immediately let those people know that they might be positive and that they need to self-quarantine. We can count on the fact that there's going to be limited public or large gatherings, right? So if you're a business that's still wondering if you should have your expo in June, I think we can make an educated guess that those very large public gatherings are not going to be happening in the next few months. Those would occur in the much later phases. And finally, as businesses open, you can count on the fact that you are going to be required to implement measures to prevent the spread of COVID-19. Okay, I'm going to take a pause there because we have just a few questions that I want to answer, and they both refer to masks. The first question is, can we require employees to wear masks as PPE? If we have office and production in the same building, does it apply to all? Is that correct? Okay, so first of all, we do need to make a distinction here between the type of masks. If you are requiring any employee to wear a respirator mask, there are OSHA requirements for properly training employees to use those. If instead you're referring to cloth masks, then yes, you can require employees to wear them. There's not an executive order right now that says you have to require them to use them, but you could if you chose, okay? And there seems to be some confusion about maybe masks don't apply in an office The current wording of Executive Order 59 is any business with in-person operations has to wear masks. Okay, so that means anybody who's being required to come to work, and I think it's fair to say, and interact with others, is supposed to be making masks available. I wouldn't assume that requirement doesn't apply just because your employees are working in an office versus a grocery store. I think the intent of Executive Order 59 is to apply to any workplace with in-person operations. Now, I know some businesses have maybe one person coming in periodically to do those basic essential operations, do payroll, for example, et cetera, and nobody else is coming to work except for that person to do those basic operations. I think you might have an argument that you're not really open for in-person operations. Okay, I have just a couple questions on the 14-day quarantine, and then we'll jump back in. If an employee wants to take a vacation and travels, do they have to quarantine 14 days upon return, and do they have to be paid to quarantine? Does their job have to be held? Okay, that depends on your type of workplace. Right now, if it is a food establishment or a pharmacy, your employees would have to self-quarantine for 14 days after returning from a trip outside of the state of Michigan. That certainly does not have to be paid. That is, but and let me back up and explain why. That is one of the questions on the required health assessment. And the executive order says that if they answer yes to that question, they've got to self-quarantine. For other businesses, meaning not a food establishment or a pharmacy, there is not currently a requirement that employees have to self-quarantine if they travel outside the state of Michigan. Okay, let's just talk science for just a minute before we jump into the list of things you need to do. And the reason I want to do that is I think it's really important to understand how COVID-19 is transmitted in order to begin to look at our workplaces and think about what we need to do to prevent the transmission of COVID-19 in those workplaces. Okay, so the first thing I'll say is this: if you haven't seen it yet, there's a webinar that was done a few weeks ago where David Boudet interviewed Dr. Van Ink. He's the director of infection prevention and epidemiology at Bronson Health, and he just does an excellent job of explaining how COVID-19 is really transmitted, and also explaining what are the most important things that businesses need to do to protect their workplaces. And so I would encourage you guys to all watch that. I'll give you just an overview here, but it's very, very informative. So number one, understand this: the greatest risk of transmission of COVID-19 is touching those respiratory droplets and then touching our eyes, nose, and mouth. The greatest risk of transmission is actually not through the air, meaning it's that somebody is just simply walking by us, for example, and giving us COVID-19. Now, certainly if somebody sneezes right on you or coughs right on you, then it could be transmitted through the air in that way. But really, they think most people get it by touching a surface with those respiratory droplets on it, and then subsequently touching your eyes, your nose, or your mouth. Also, understand that it lives on surfaces for hours, not days. So Dr. Van Ink says the half-life of COVID-19 is about 1 hour, okay? and he does a great job of explaining what the half-life is. I will not even try to explain it as well as he did, but I can tell you what that means then is the risk of it, right? Almost all of those germs are gone within hours, not days. So if we know an infected person was in our workplace 9 days ago, right? We know off the bat that it's highly unlikely that there is any risk of transmission still in our workplace because that person was in there. Also, the virus is actually quite easy to kill with soap and disinfection. Okay, so it's not difficult to kill when we're wiping down things, when we're washing our hands, etc. So based on those things, what Dr. Van Ink says our greatest opportunities to protect the safety of our employees are in this order, actually. Number one, encouraging and enforcing hand washing. So remember way at the beginning of this COVID-19 global pandemic, the CDC told everyone to wash our hands and not touch our faces. There was a reason they said that, and that continues to be incredibly important, okay? So having our employees wash their hands on a regular basis and making sure they have the opportunity to do that is very, very important. Second, cleaning and disinfecting those high-touch surfaces throughout the day in our workplaces is very, very important. Third, those social distancing measures, making sure everybody's not right on top of each other, that there's space. And that's both so that they don't cough and sneeze on each other, but also so that respiratory droplets aren't landing on surfaces and then somebody else is right there within close proximity of the same surface and touches that and then touches their face. Dr. Van Ink thinks the cloth masks are probably farther down the list. We all might not have any choice. That may be something we're required to provide in our workplaces regardless, but they're certainly helpful. They're really more helpful for preventing employees from touching their face, quite frankly, than anything else. They can, if somebody coughs or sneezes, then the cloth mask can be effective at not transmitting those germs to another person. And also, if somebody's wearing them, they might be less likely to touch their eyes, their nose, or their mouth. Now, I will say, if the cloth masks are fitting in such a way that everyone is fiddling with them all day, that completely defeats that purpose. And then finally, Dr. Van Ink would say those pre-work health assessments / temperature checks are probably the last of importance on that test, primarily because once somebody has those symptoms, they've already probably brought it into your workplace. So you might every once in a while catch an employee who's not feeling well and shouldn't be there, but that's going to be more unusual. Again, we may not have a choice but to do those. But if we're making the rules, that would be the list of importance. Okay, so the good news here, guys, is that lots of businesses have continued to operate, and we've learned a lot of lessons from their experiences as to what we need to do and strategies to get it done. So with that, let's jump into the steps, your checklist of what you need to be doing now to get ready, okay? Number one is a COVID-19 preparedness and response plan. If you're a business in Michigan, I can almost guarantee that Governor Whitmer is going to require you to have one of these. She seems to really like them and really like the idea. And the plan will have to be in accordance with the OSHA guidance. I included a link to that on this slide. I will also say that a few weeks ago, my colleague Sandy Andre and I presented a webinar on these plans. So go back and listen to that and look at our presentation for those contents. This is already required under Executive Order 42, also got re-upped under Executive Order 59, okay? And the basic steps that these plans require is you got to identify the sources, who's going to come into your workplace and spread it. You've got to establish which risk categories your employees fall into. So the OSHA guidance has low, medium, high, and very high risk categories, and the measures you take are dependent upon which of those categories your employees fall into. You're going to have to figure out who your COVID-19 workplace coordinator is and or establish a task force for that purpose. Either one is fine, and which you decide, whether it's one person or a task force, I'm sure will depend on the size of your organization. And then most importantly, you're going to have to list all of your worksite preventative measures, all the things that you are going to do or have done to protect yourself from COVID-19. Okay, I'm going to pause there and just answer a few more questions. One of them is, do we have to quarantine delivery drivers who travel to Indiana from Ohio? So no, if somebody is crossing state lines in order to do their job or come to and from work, they do not have to be quarantined for 14 days, thank goodness. The next question is, how do we enforce hand washing? Well, I suppose we enforce that as we enforce any of our workplace requirements, right? It's twofold. The first is you can certainly tell employees that they have to do it, and they have to do it at certain intervals during the workday. And then, of course, from a practical standpoint, we will have to provide them the time and the ability to do that, right? So it doesn't do us a whole lot of good to tell employees they have to wash their hands if we're out of soap, or if actually the sink is a short walk away and they're not allowed any breaks during the day to do it, okay? So you got to make it a requirement, and then you have to think through the practical obstacles that might be present that would prevent them from doing that. Okay, second item on your checklist is you're going to identify who your available workforce is. Who are the people who are going to be able to come back to work? And you're probably going to also be comparing that to your needs. Who do you need to come back to work? But you're going to have a certain percentage of your workforce who is not currently available to work for COVID-19 related reasons. And I mean that in a very broad sense, right? So it could be employees who are self-quarantining because they've had close contact with somebody with COVID-19. It could be somebody who's in that at-risk population, right? Somebody who has lung disease and their healthcare provider has advised them that they need to self-quarantine for a period of time. It could be employees who are unavailable because their kids are home from school or daycare, okay? So on your list is going to be figuring out a way to sort through who's available and who's not to work so that you can get your hands around that. If you have not had in-person operations at all, and you therefore haven't been required to become familiar with the family's first paid leave opportunities, those apply to employers, by the way, only if they have less than 500 employees, then you're going to need to become familiar with those because some of those reasons I just listed out are job protected under the Families First Act. The other thing I'll say is as you identify your needs and your available workforce, you might consider the Michigan Unemployment Work Share Program. That's a program by which you can call back more people to work a reduced schedule. Okay, so if you have a need for 50% capacity right now, one option would be to call all of your employees back to work 50%, and another option would be to only call back half of your employees. If you wanted to explore the first option, there's something called work share, and you reach an agreement with the Michigan Unemployment Agency by which they are allowed to continue to collect their unemployment benefits. They remain eligible for unemployment benefits in addition, and they also get paid for the time they work. Now, their unemployment benefits will be reduced to reflect the wages they earn, but they still get their full $600 CARES supplement every week. Okay, so the end game is that employees who are engaging in a work share program often end up making more money than they would if they worked full time. Okay, third item on your checklist is your employee communication plan. One takeaway, I should say, that businesses that have continued to operate have learned is that employee communication is just critical. Individuals are scared, they're confused, they're concerned about leaving their homes, they're concerned about coming to work and bringing COVID-19 back into their homes, and this results in an extremely high rate of absenteeism, okay? So from the beginning, it's very, very important to communicate the measures that we're taking to implement safety measures into our workplaces, and also inform them on how COVID-19 is transmitted and the measures that they should be taking also to protect themselves and their coworkers. Okay, so the emphasis is safety. That should be in their callback letter. And I would encourage all of you to consider that thread of safety communication even after they return to work, right? Think about weekly communications, et cetera. You're going to want to demonstrate to your employees that you know, you've studied COVID-19, you've looked at the CDC guidance and we're in compliance with it. We know the OSHA guidance and we're doing everything that OSHA suggests that we need to do given the level of risk. And we want to explain what preventative measures we're taking. We want to tell them who the workplace coordinator or task force is, and then, of course, educate them on their responsibilities, too, to reduce the spread of COVID-19, right? Like sneeze into your elbows, wash your hands, don't touch your eyes, your nose, and your mouth, etc. There's a good page on the CDC website that talks about what employees could do, and you could even use that and turn it into a posting. Next item on your checklist is to evaluate and figure out your hygiene and disinfection practices. Okay, so I divide this into two categories. When I say hygiene, I mean those practices that your individual employees are employing to have to not be carrying the germs around on their own hands and to not spread it through coughing and sneezing, okay? So that includes those communications regarding proper hand washing, et cetera, postings with that information to employees, and then also the hand washing piece that we talked about, right? So the communications and the hand washing. The second big category is the disinfection and sanitation, okay? Those are measures that the business or the employer is taking. What are we doing to disinfect our workplaces? Traditionally, many workplaces did regular cleaning at the end of the workday. We're going to be looking at doing it taking some additional measures during the workday and definitely between shifts, okay? So you're going to want to identify those commonly touched surfaces. Where are those places that lots of people are coming and touching, and how do we make sure those are disinfected regularly throughout the workday? Do we assign people to come in and do that? Do we have spray bottles and wipes available at those places and require employees to spray it down as they come and go, for example? Think through those things. You're going to want to require employees to clean their own workspaces at the beginning and the end of each workday, and eliminate shared use of items when possible. We saw that on Executive Order 59, and Whitmer has already said that she thinks the shared use of items is a key piece to deciding who gets to open back up and who doesn't. So if you have employees sharing tools and equipment, et cetera, think through, number one, is there a way to avoid that? Do we need to buy more tools, for example, so that everyone has their own? And or if that's not a possibility, how are we going to clean those and disinfect those to prevent the spread of germs? Next item on your checklist are the social distancing measures. Goodness, 2 months ago, if somebody came into probably almost any workplace in America and said, none of your employees are allowed to get within 6 feet of each other, we all would have laughed, right? It just would seem like such a crazy idea and unworkable. Unfortunately, that is where we are, and I think it's very, very likely that when we come back to work, we are going to have a requirement that businesses are going to have to do everything they can to make sure employees who are working are 6 feet apart. Those employers that are currently operating, including manufacturing, have been required to do this, and they have figured it out. It's amazing what we can do when we have to, right? We can be very creative and think outside the box when we have to do it. So plan on it, think about it, look at your workplace and think about who's working within 6 feet of each other and how we are going to address that, okay? Limit in-person meetings whenever possible. Common areas are going to be a big deal. Break rooms, cafeterias, those places where people gather, and it's very difficult, number one, to keep them 6 feet apart, and number two, there are those shared surfaces all over the place, and we're not sure whether we're going to be able to clean them. Many employers, I've got manufacturing businesses telling me that they've decided that the break rooms and cafeterias are closed and everyone is going to their own cars to eat lunch, for example, okay? You may need to stagger work schedules in shifts, right? So for larger employers with a lot of employees arriving to work all at the same time and clocking in at the same time, many employers are currently telling them exactly what minute they're supposed to arrive in order to avoid that backup of people on top of each other as they're getting into the workplace. Marks on floor, we've all seen them in grocery stores, right? They're in production facilities too, reminding people to stand 6 feet apart when possible. If you have employees who can work from home, it's likely that you will see a requirement that you continue to allow it, if feasible, to reduce the number of employees you have in the workplace at any given time. And then in situations where a 6 foot distance is not feasible, you consider if there are those barriers you can erect, right? So you've seen them at the grocery stores, those plastic barriers between a customer and the grocery checkout person. Be creative about that. You may also need to consider that, for example, in your reception area. Okay, I've got a couple of questions, so let's just take a breath there and answer a couple of questions here. The first one is, can we ask them to take a COVID test if they say they have symptoms, and can we ask for a copy of the results? Well, there's nothing wrong with either of those ideas. If an employee calls in and says, I have the symptoms of COVID-19, there would be nothing wrong with saying, well, we'd like you to seek getting a test. The challenge, of course, is that it's not up to us as to whether they get a test or not. It continues to be the case that employees have to go through a phone triage system with their local health authority and or a medical provider, and they get to decide whether those organizations get to decide whether they get tested or not. If they do get tested, can you ask for a copy of the results? Sure, there would be nothing to prevent that. That's medical information that would absolutely be relevant to safety in your workplace, as well as their ability to be off work, et cetera. So I don't have any problem with asking for the tests. What should companies do with employees who travel in the same vehicle for work? That is certainly a concern because you can't be 6 feet apart in the same vehicle. Ideally, unfortunately, right, you would want them to not be in the same vehicle, take 2 vehicles. If that's not possible, I like the idea you mentioned of wearing a face mask, making sure, tell them they're not allowed to touch the same surfaces, et cetera. This is an example of the challenge of getting our head around this world we're living in right now. I know it sounds almost silly that we can't allow employees to ride in the same car, but the reality of that is that it's probably going to be difficult to comply with the social distancing requirements if you have 2 employees riding in the same car. Does work share impact PPP requirements? That's the Payroll Protection Program requirements. Well, it would only impact it in the sense, work share itself does not know. The PPP repayment obligations or let's say the loan forgiveness piece of that is based on your total payroll. So whether or not you're doing work share shouldn't directly impact that. The relevant factor is how much payroll you're providing your employees. Are disposable masks available? We came up with disposables, but can't provide everyone with cloth masks at this time. So what Executive Order 59 says is that employers with in-person operations have to make non-medical grade face coverings available. So I think that would be fine. It doesn't specifically say they have to be cloth. If an employee travels for work on a plane, what should their wait time be before coming back to the office? Okay, so currently the requirement that would apply to a food establishment or a pharmacy is that if they travel outside the state of Michigan at all, they're on a 14-day self-quarantine. There's not currently a requirement for in-person businesses other than food establishments or pharmacies. If you're asking from a practical standpoint, what should you do or what do I think likely will be applied, I think it's likely that there is going to be a prohibition against traveling outside the state of Michigan, at least through the month of May, right? So if we're having employees come back to work sometime in May, I think it's likely our governor is going to tell employers that they can't have folks traveling and then coming back into the workplace. It's possible that we would allow, that it would be allowed with certain higher health assessment requirements, right? So that person could travel and come back into the workplace, but each day before they are allowed to enter, you need to do a health assessment on them and perhaps do a temperature check to make sure they're not sick. Okay, so let's continue on. Oops. Next item on your list, protective gear. Think through what protective gear you're going to need to have. And by that, I mean masks, and more masks. Unfortunately, so many employers and businesses got caught unprepared on Friday when Governor Whitmer said that by Sunday, they had to make masks available to all of their employees because masks just are not widely available right now. They're really hard to get. Okay, so if you're not open yet and you're looking at the possibility of people coming back to work in a few weeks or by the end of May, something like that, start getting those masks now, thinking through how you're going to get your hands on them. People are making them. I have some employers with folks on layoff, and those employees are making masks, and they're getting paid to do it. So be creative. How are you going to find those masks? Okay. Gloves. Gloves, I don't think will be a requirement unless it's a real customer-facing position or they're preparing food, something like that. That's not something the CDC is widely recommending. That's not something that Governor Whitmer is requiring, and the infection control folks generally think that gloves aren't used properly anyway, so they don't do a whole lot of good. Next item on your checklist, you're going to need to review and revise certain policies, okay? Number one, you're going to have something prohibiting employees from coming to work if they have COVID-19 symptoms, if they've been in close contact, and or if they've traveled internationally or outside of the state of Michigan, okay? And as part of that, we're going to need to educate leaders to send them home if they're sick. We're going to need to think about what changes to policies we need to reflect the paid leave and protected, the job protected and paid leave obligations under the Families First Act. Remember, Executive Order 36 says employees can be off work for COVID-19 related quarantines, and that's job protected too. So we need to take a look at our attendance policies and sick leave policies to make sure we're complying with that. And we're going to want to take a look at our safety policies. Now, the trick of this is that these policy changes, hopefully, right, are not going to last forever, but they are going to be around at least through the end of this year, and very likely beyond that. So how you implement those changes will probably depend on how you keep your policies now. But for example, it would be fine to come up with a communication to employees explaining how your current policies have been temporarily amended and list those things out in that one communication, rather than completely revising a handbook and handing out a new handbook to all of your employees, okay? But read that handbook cover to cover, understanding your legal obligations, and think about how those policies need to be changed And I'll say too, if you have collective bargaining agreements, obviously we're going to need to look at those too and think about those conversations with the union about what, if anything, needs to be changed in those. Health assessments, okay? On your checklist is going to be at least an evaluation of what you're going to do if there is a requirement for some sort of health assessment before employees are allowed to come to work. And I think this could come up in two ways. It could be that you are all required to do this for all your employees before they enter the facility each day. And that could be because Governor Whitmer requires it, or it could be because your facility is in a county in which the county health department is requiring it. It could also be, though, that there is a requirement that only for certain individuals we have to do health assessments before they enter the building. So, for example, it could be that if an employee has been in close contact with a known case of COVID-19, but that employee isn't sick, they don't have symptoms, it might be the case that we can let them come to work, but only if we do a health assessment on them each day, right? So the health assessment requirement could apply to everyone, or it could apply specifically to certain individuals who maybe had close contact with somebody who has it, or maybe has traveled, etc. So think about, assume that some level of that requirement is going to apply, and think about what you need to do. There are two ways of doing it. There's the written affirmation, meaning we don't actually have one of our employees check somebody's health. Instead, that individual affirms whether they have any symptoms, whether they've been in close contact with someone, and whether they've traveled. The symptoms will include whether or not they have a fever. So if you're going with some sort of written affirmation, they will have to have some means by which they take their own temperature before they come to work. I will tell you, I recently learned that Spectrum Health has developed a really cool app for this. It's the Temperature Checker app. And the app is set up so that employees can, 4 hours or less before the start of their shift, actually enter their written affirmation for all of the items into the app, and it's transmitted to the employer, which I thought was pretty cool. Temperature checks themselves might be required. Again, as I noted, that could be for everyone. It could be only for certain employees if they've traveled, for example, et cetera. You're going to want to have some touchless thermometers in case there is that requirement. Also, I've had several businesses have success contracting with a medical staffing agency to come in and do those temperature checks for them, right? Because otherwise we're sort of looking around the HR department or the operations department and trying to figure out who gets to go take everybody's temperature before they come into the building, which is tricky because obviously you have to get within 6 feet of people in order to do that. One particular agency that I know is doing this called Diversified Medical Staffing. Okay, almost done here with our checklist, guys. Next item is create your positive test protocol and think through your contact tracing. This is really, really important. As COVID-19 is going to be around, people are going to continue to get it. People are going to continue to test positive. As we open back up, I think we just have to assume that at some point one of our own employees or somebody else in our workplace is going to have COVID-19. you're going to want to have planned out ahead of time exactly what you're going to do when that occurs. Okay, so have that positive test protocol. The basic items are listed there. I mentioned contact tracing before. That refers to the process by which when somebody tests positive, how do we identify who was in direct contact with that person, and how do we get a hold of them? Okay. It goes without saying that we want that list to be as short as possible, and we want it as easy as possible to get a hold of them. So we're going to want to think more about who's in what areas of our workplaces than we ever have before. We're going to want to, if at all possible, we want people to only be where they have to be in the facility, right? Both employees and visitors, okay? And think about how we can keep track of who's where and how we can get a hold of them. Now, we're going to know how to get a hold of our employees, but we need a log for visitors, customers, and vendors, and we need a process by which we make sure those people only go to where they absolutely need to go in the facility and they're not all over the place. Procurement, this goes without saying, right? On your checklist, what are you buying now? What are you searching online to find, right? So the tissues and non-touch disposable receptacles, those cleaning and disinfection supplies, the cloth masks, and the health assessment supplies. That's my short list of the things you want to buy. You might also add, if you're going to be marking off different parts of your workplace, you're going to need tape to do that, right? Paint, tape, etc. And then finally, you're going to have a plan to communicate with customers, suppliers, and other business partners. So this is the last thing on your checklist. Think about your supply chain and who you need to communicate with to make sure you have the supplies and parts that you need to operate. And also for your business partners that are going to be sending individuals into your workplace, communicate those requirements for entry in writing to them, right? So if they're sending vendors in, make sure they clearly understand that those vendors are not allowed in if they have any symptoms. Make sure they understand our hygiene practices, our social gathering, our social distancing requirements, and also the sign-in requirements for the purposes of contact tracing. And if we're going to make them complete a health assessment form, then make sure that's clear too. And then finally, the last slide is just other things that you might think about. I don't think these need to be on a checklist necessarily for everyone, but they may be relevant to your organization. First, the OSHA guidance does mention that increased ventilation, circulation of air can be helpful in preventing transmission of COVID-19. So is that a low-hanging fruit maybe for your facility, right? Can we increase those ventilation rates and circulation? Work-related travel. If you're a company or a business that has a lot of work-related travel, you're going to need to evaluate that and think about what it means when those people come back from the travel. And then plan for attendance issues, plan for additional call-ins, cross-train then if you can, incentive pay. Many employers who have continued to operate have moved to increasing pay and providing incentive pay for employees who are coming to work, and you may have to engage in relationships with contract staffing if necessary. Okay, so we have just two questions here that I'll answer before we continue on with our Mondays. The first one is about that Michigan WorkShare program. Can you reduce pay and still require employees to work the same hours since they will make up the income with unemployment and the $600 supplement? So that's a pretty complicated wage and hour question. For hourly employees, obviously we have to pay them minimum wage for all the work they do. So we could never reduce them below minimum wage and say that the unemployment agency is making up for that. That would be unlawful. And then, of course, we would have to be mindful of union contracts that guarantee certain wages. For hourly employees as well, I would also think there's employee morale considerations to evaluate if we're going to implement a wage cut. Of course, if you have a PPP loan too, you're going to need to think through that. For salaried exempt employees, if you reduce their salary, you cannot reduce it below the required salary threshold, and you have to pay them their full salary if they work any part of a week. So that's going to complicate that too. Next question, how long do you have to keep the written affirmation on file? That's a great question. So that's that health assessment affirmation. There's really no guidance or recommendation on how long to keep those. From a practical standpoint, I would say 30 days is plenty because the incubation period for COVID-19 is 14 days, right? So in terms of contact tracing and other things, it's hard to imagine that information is going to be relevant beyond 30 days. I think that's plenty of time. Do I know the specific name of the Spectrum Health application? I think it's called Spectrum Health Symptom Checker. Okay, try that. All right. One more question just came in. Please clarify. Salaried exempt can still do work share on reduced hours. Yes, it is possible to set them up, but it doesn't forgive your requirements under the Fair Labor Standards Act. So you still have to pay them that minimum salary for them to be exempt or transition them to hourly for a short period of time. So that's a pretty complicated wage and hour concern. And I'd suggest you probably talk to a wage and hour attorney to talk through those specific requirements and options, okay? The last thing I'll say is Miller Johnson is putting together a return to work kit for employers that's going to have a lot of the things we talked about here, that COVID-19 response plan, the communication to employees, a checklist for everything you need to do, a checklist of the policies to look at, the positive test protocol, et cetera. And so watch for that. Sometime at the end of this week, we will be rolling that out. Thank you all for joining today, and I hope you have a safe and healthy Monday and a safe and healthy week. Thank you.